But welcome. So for those who don't know, my name is Nick Murphy. I'm with Counterweight Private Wealth. We are a independent boutique fee-only wealth management firm doing financial planning, retirement planning, and such. And in doing so, we constantly are, helping people navigate through transition points. And one of the most common, obviously, is retirement and all the various different decision points that go along with that. Social Security and how to optimize that, income replacement, you name it. One of the key decision points that always comes up is something that I'm very excited to be able to talk about today, and that's Medicare. It's a very complex topic, and it's something that really deserves a lot of expert attention instead of just making a willy-nilly decision. So that being said, I'm thrilled that we have a special guest join us today, which I will introduce in a minute. Before I do, a couple quick housekeeping items. First, as with all these webinars and sessions that we do, it's important to know these are just informational and educational in nature. Please don't specifically act on anything you may hear that may not be specific to your situation. We always suggest that you contact someone and have individual specific advice relative to your situation. At the end of this session and throughout, you're going to get Nancy's individual contact information. You can certainly schedule time with her directly. So please don't act on anything you hear without really understanding how it might involve you in your specific situation. The second thing is that there's probably a lot of questions that will come up in this session. And so if you will, at the bottom of your screen here, you should see a Q&A button. And if you just want to simply type your question in the Q&A section, hopefully at the end of the session today, there'll be some time to address some of those questions. I'll be able to see them and read through them and ask Nancy some of those individual questions. So let me introduce our speaker today. With a heart fueled with compassion and over 15 years of personal caregiving experience herself, she knows firsthand the importance of finding the right Medicare coverage. And so she'll probably talk about how she was inspired by her father's journey with Medicare and what that led to. Now she's happy to ensure that others can really make constant and important decisions that are best for them. She listens to needs, she researches all the options, and ultimately her job is to help you find the right plan when you sign up for Medicare as well. So in fact, I think the number she mentioned is over the past 12 months, I think she's helped 183 people enroll in Medicare, which if you do the math is a lot. And so she's based out of New Jersey. A couple quick family items. She resides with her family and their irresistible cockapoo Ziggy, which up until about 5 minutes ago, until I just Googled it, I thought a cockapoo was a bird, but it's a dog. And so anyway, that's just shows how much I know. But anyway, I'm going to turn it over to Nancy. Nancy, thank you for taking some time today, and the floor is yours.
Okay, well, thanks so much, Nick. It's a real pleasure to be here today. And folks, thanks for joining us today. A couple of things I want to add to what Nick had to say about what materials you'll get afterwards and really how to get the most out of this webinar. What I found after years of presenting and training is that particularly for a topic like Medicare, which is very detail-oriented, it's most effective to be all in during the session. For that reason, I didn't provide any materials for you to have at your side while you're with us today. However, Nick will email out to all who registered, plus tomorrow morning, or perhaps a little later in the day, a video of today's session and a handout that I've put together that will act as a worksheet for you to getting your Medicare right. Whoops. Nick, whoops. Ay, ay, ay. Sorry, folks, I had a little crash with my PowerPoint, as you know, frequently happens. No matter how expert you may be, that's just how it goes. And here we are back to it. Okay, well, as Nick mentioned to you, I got into this practice about 6 years ago now, after shepherding my dad, Manny, who you see here, through the end of his life. And during that time, which, as any of you who've cared for a parent in their final years knows, it's, you know, very tough, very upsetting, very loving. One of the things I became very engaged with was, how could I help people my age, I just turned 64, and older, have the same kind of quality of life Dad did? And after thinking a lot about it and talking to a lot of people, lots of informational interviews, I realized that the strength of his Medicare plans, together with the original Medicare, that's what we call Medicare from the government, was fantastic. And he had access to the healthcare he needed from the docs and other providers he preferred without financial worry. So that's when I decided to jump into the Medicare business, and I love it. Today, I want to share with you 3 steps for getting your Medicare coverage right. As Nick said, it's complicated. What I'll talk about today is general information. Every single one of your situations is absolutely unique. Absolutely. So I won't be really addressing your individual situation, but there are some commonly relevant strategies I'm going to share with you today, which will force you in a way to think about what your healthcare insurance needs and priorities are, and then how do you match those with the right Medicare approach and plan. As Nick mentioned, I focus solely on Medicare. I'm what's called an independent broker, representing many insurance companies that provide Medicare plans. And when you use a broker like me, you pay the same as if you enrolled directly with the insurance company. There's just a commission built into every premium, and that's what I am compensated by, rather than when I enroll and guide you, rather than having the insurance company keep it. So just like to get that straight. One of the things or I guess the thing I've taken away from my years in this field to date, is that making thoughtful Medicare decisions based on a clear understanding of this very complicated system and your healthcare priorities is key to smart and responsible healthcare planning and retirement planning. Healthcare planning is a critical element in your retirement planning. We're going to address these common burning questions. These are the questions I hear all the time, especially, I have to enroll at 65, right? But we're going to go beyond that today. And we're going to really unpack the problem that stands in the way of most people matching themselves with the right Medicare plan. And then I'm going to share with you the solution that I've tested. It's a proven solution, so that you're able to do it right. First of all, remember that most people start planning for retirement when they're 40 or 50. Nick might tell me that some folks he works with don't even start thinking of it till later, but a lot of people start earlier. But few people invest the same attention and effort in selecting the best fit Medicare approach, even though comprehensive healthcare coverage is part of that retirement planning. The reasons for that: there's too much information and much of it is wrong. By the way, if you have a stack of mail, or you're going to be 65, you're going to get one, throw away everything that doesn't come from the government. Center for Medicare and Medicaid Services, CMS, which is the federal Medicare agency, or Social Security. That's a quick way to filter those materials. The other point is, as Nick mentioned, this is a very complicated system, and it's an illogical system. So people are always trying to make sense of it. That's our natural inclination, but it has its own rules. And I'm going to share some of those with you today. Here's some of the other reasons that people make the wrong decision or no Medicare decision at all. Frankly, to a lot of people, it's just overwhelming. And it's really hard to pick apart. So people just do what their mother did, or their friend down the block, or pick an insurance company they had before they enrolled in Medicare. Any one of a number of triggers to enroll sort of willy-nilly in a plan. You're not alone in this. The Kaiser Family Foundation does a fantastic job of researching what's going on in the healthcare sector. And in this study, they found that less than 50% of folks who enrolled in Medicare plans used research tools, and I'm going to share some of them today, or professionals to help find the right plan. So when you're thinking about your own retirement and how to protect your future, this may be an alarming picture. The result of not making a decision or making a poor decision is quite significant. But as you'll see now, there is a proven and doable 3-stage Medicare planning path that enables you to do it right. So today, I'm going to walk you through this 3-step process to getting the right medical care plan. And that's for those of you who are just enrolling now, will enroll soon, as well as those who are already enrolled in Medicare, because there are opportunities and reasons to change your Medicare plan over time. Again, today, when I talk to you, I'm going to talk about things that you can all do. Some steps that are relevant to every one of you, no matter your situation, okay? And please, as Nick said, put your questions in the Q&A as they come to you, so you don't forget. Some of them may be covered as I move through today's presentation, but I hope to have time at the end. I have slimmed this down so to ensure that I do have time to have an active discussion with you about what you need to know about Medicare. So, what's your first step here? Figuring out when to enroll. And the reason that's the first step is that right here is where many people make a huge mistake. So there are clear guidelines when to enroll in Medicare to avoid both gaps in healthcare insurance coverage and accruing pricey penalties that are going to stick with you for the rest of your life, even after you enroll in the right plans. First, we're going to talk about what I call original or traditional Medicare, the Medicare that you get from the federal government. And that's part A and B, as you see here. By the way, let me interrupt myself and just mention, take screenshots with your phone if that's helpful to you. Some of these images people find very helpful, and it may be easier to remember with a photo. Okay, so enrolling on time is very, very important. So the first thing to understand is, when are you even eligible to enroll in original Medicare? That is when you're 65 or older, you have a disability, and there's certain criteria for that, and any age with certain illnesses. You must be a U.S. citizen or a legal resident for at least 5 consecutive years. Here's when you enroll at 65. when you're retired already, when you're no longer working, or maybe you haven't worked. If you're on an ACA or exchange or individual plan, when you and or your spouse or domestic partner who's provided employer provided insurance no longer have that insurance, or, and this is an important one to remember, when your employer has less than 20 employees. If you do have to enroll at 65, and again, that might be a self-employed person, someone who works with a small organization, someone who's not working now, but got covered by insurance provided by his wife's employer and she's retiring. Let's say you have to enroll at 65. You have a 7-month window, as you see at the bottom of this slide, to do so. That starts 3 months before your birthday month and goes 3 months after. I urge you, this is what I guide all my clients to do, to enroll as early as possible. You enroll through Social Security and they do a great job. It's a massive enterprise, but once you enroll, it's out of your hands. And sometimes it's done overnight at 65. Sometimes it takes a couple of months. So do what you can to enroll on time by enrolling at your first opportunity. Even if you do that, it's not foolproof. I had a client last summer, Frances. She enrolled. I guide everyone how and when to enroll with a step-by-step email. She did so on the first of 3 months before her birthday month, and her enrollment wasn't processed. I had to guide her how to nudge along the Social Security office through asking for a supervisor to finally get enrolled. And she was just processed yesterday, actually, for it because there was a big snafu for what was supposed to be an August 1 start date. That's rare. I don't want to frighten you, but get a jump on it when you can. By the way, even though I'm focusing on original Medicare now, parts A and B, there are also timelines for when you have to enroll in your plan, your complementary plans that fill the gap in original Medicare. And I'll talk about those in a little while. But before you can even think about those, much less enroll in them, you have to enroll in original Medicare. That is your first step. One of the things that people aren't aware of is these criteria for if you're employed and you turn 65, when do you have to enroll and when don't you have to enroll? I'm talking to someone right now who works for a small nonprofit in New York City and is totally confused about this. She thought, as I would have before I got into this field, that because she had employer health care, she didn't have to enroll in Medicare at all. But in fact, as you see in the left box here, she does. She has to enroll in Medicare right now to start at 65. On the other hand, if you work for a larger employer and employees 20 or over, then your employer benefits will actually continue to pay first, and that remains your primary insurance, and you can defer Medicare enrollment. When I tell people about this and I reassure them they shouldn't take any step right now, people understandably are very concerned about accruing a penalty. But let me make it clear that when you do retire from a larger organization, you have what's called a special enrollment period to enroll in Medicare without a penalty. And you do so by providing proof that you've been covered by by insurance equal to Medicare since the time you've been 65. You'll note that when you're enrolling via this special enrollment period, the jargon is LEC, or leaving employer coverage. you enroll then 2 months before your start date, not 3 months as you do when you're 65. That's nothing that you have to remember, but it's just indicative of how there's so many different twists and turns with the Medicare system, and really a lack of consistency. Okay, as I mentioned, you do enroll in Medicare through Social Security. I suggest that all of you set up a Social Security account online at ssa.gov. Whether Medicare is in your near future or not, it's really very useful. It's a very quirky site, so it can take some time. And I've had folks who were actually delayed with their Medicare because if you can't get in and you can't set up an online account, which is the best way to enroll in Medicare, they actually mail you the login reset information. So Social Security can be very slow in some cases, which again is why you want to start as soon as possible. If you can, I would say start 6 months before the time you want to start your Medicare. Lots of times I have people coming to me, they might be over 65 or under, but nearing, and say, I just lost my job, or I'm on my domestic partner's employer's insurance and he took a severance package. There's always ways we can cover you. But if you have the choice, give yourself all the time possible. I have, an interesting story to share with you about my client, Lucy Alper. And she actually is someone who works for a large employer. She turned 65 and her husband did a couple years later. And when he did, he insisted that he enrolled in Medicare Part A and B right at 65. He was, even though I had worked with her, I told her, no, you don't have to do a thing. He insisted. Okay, now she's retiring. And because he already enrolled in Parts A and B of Medicare, has lost a special opportunity. He's lost the opportunity to get one kind of plan. It's one of the approaches you use to fill the gaps in Medicare from the government, which is a supplement, a Medicare supplement. He lost the opportunity to get that without a review of his health history. This is another quirky rule. You have one chance to get a Medicare supplement without a review of pre-existing conditions, and that's within 6 months of your enrollment in Part B of Medicare. I mention this again because don't worry about knowing what your timeline is. The professional you work with will talk to you about your timeline so you can jot down key dates and key action items along the way. But there's quite a variety. Here's a common call that I get. I'm 72 and planning to retire in 4 months. When should I apply for Medicare? In this case, there are a lot of steps. About 3 months before you retire, you complete a form, and I'll guide you through all of this, or whoever you use as a guide. You have to get a proof signed off by your employer that attests to the fact that you've been covered by strong health insurance equal to Medicare since you've been 65. You then enroll in Medicare for the first of the month that you'll be without employer coverage. And some people say or assume that they don't have to do that because they get COBRA, or in certain situations when they've taken a COBRA package, they don't have to do it. They can, and in some cases that's paid in full. The premium is paid in full by the former employer. Even if you have that, you have to start Medicare right away. because COBRA is not health insurance that is equal to Medicare. And if you only have COBRA, that is not going to pay for your full medical expenses. You may be thinking, okay, this is all great to know, but what do I need to understand about all those parts and plans of Medicare and how they work together so that I can know what's right for me? So the way to do that is understanding the decisions that you have to make and the choices that you have. Here are the parts and plans of Medicare, and this is a good slide to get a screenshot of. I've worked and worked and worked on this graphic. It's really hard to explain, but people seem to get this as much as you'll get it. Okay? So the thing about original Medicare, parts A and B from the federal government, is that it's a very robust system. 99% of physicians nationwide accept it. Every hospital there's not really a network, but every hospital in the US accepts it. You never need a referral or prior authorization, and you can use it wherever you are in the US. So that's great, really great. And it's comprised of these two parts. Part A, which is hospital room and board. And aside here, when you're enrolling, you may choose, and if you're 65 and you're working for a large employer, but not contributing to a health savings account that's usually paired with a high deductible health insurance plan, I will guide you to enroll in Part A, for which you've already paid the premium through the FICA taxes you paid over the course of your career when you turn 65. Glad to discuss that with all of you. Again, another confusing point. Part B is medical insurance, which is very comprehensive, covering everything that you see here. But original Medicare doesn't cover everything, and it's not free. As I said, your Part A premium, if you've worked 10 years or more, or if your spouse or domestic partner has, but you haven't, that premium has been paid for the rest of your life through the FICA taxes. For Part B, though, there is a monthly premium. The baseline in 2024 is $174.70, but that is an income-based premium. And being aware of that is a great thing of what your income looks like and what that's going to indicate in terms of how much you pay for your Medicare. That can be a big surprise for some people. The additional amount that you pay is called IRMA, snappy acronym, Income Related Monthly Adjustment Amount. So that's a great thing to talk about with your tax planner and your financial advisor. In addition, you're responsible for all the other costs you see here. Let's assume you're pretty healthy and you're not even going to be admitted to the hospital, or it's very, very infrequent. Let's just look at Part B, your everyday medical expenses. Well, you have a $240 annual deductible. That's nothing. It's a lot less than most people have. But in addition to that, you are responsible for a 20% cost share of every single medical bill, which can get really expensive really quickly. And in 42 states, you're also responsible for the optional excess charges that run up to 15% of the Medicare reimbursement rate for the visit or the procedure. And that amount represents the gap in reimbursement between the Medicare rate and the private insurance reimbursement rate. So as you can see, it can be very expensive to have original Medicare alone, despite the fact that it is such a robust and flexible system. So you have the option of choosing between two approaches to fill the gaps. Okay, I'm going to talk to you a little bit about this. On the left, we have the Medicare supplement. That's what my dad had. It was right for him. Those mirror the framework of original Medicare in terms of flexibility. One of the greatest things I talk about with clients is there are no prior authorizations required. And for all of us pre-Medicare, that is unheard of. For these supplements, you pay a flat monthly premium. They come from a private insurer, although the plans are standardized. So CMS, the Federal Medicare Agency, designs these plans. Right now, for supplements, there are two main options, Plan G and Plan N. They each have strengths, and they each have, and there are some weaknesses, but those are your main choices. You pay a flat monthly premium for those to the private insurer. There are criteria we use to recommend them that are related to how quickly the premium is likely to go up. What's nice about that model is it gives you a lot of flexibility, and you know exactly what you're going to spend on your medical expenses over the course of the year. So it limits your financial risk. All right. That you get, and you pair it with the required Part D medication insurance, a drug plan. And with a Medicare supplement, you get a standalone drug plan. On the right, we have the Medicare Advantage plan, which works much like under 65 insurance, in that you have one card, one plan, and it covers both your medical care and your medications. It's an HMO model. It's totally privatized. And with an Advantage plan, by the way, this is what most of the promotion that you get, or calls, mail, emails, it's all going to be about this because this is most profitable for the insurers. But it works very well for some people. Just make sure you know you have a good reason to choose that. So it's privatized. The government hands over management of your Medicare to the Medicare Advantage insurance company. You pay as you go. There is a ceiling on how much you'll have to pay each year. There's a limited network of doctors and hospitals, and it's not standardized. Some of the strengths are sometimes this includes, I only recommend this if it includes the drug plan, which is legally required, and sometimes it includes dental and or vision as well. Part D is your drug plan, and I've mentioned that, and that's something you want to review annually and make sure you're the best one, and I'll share with you the criteria for choosing that in just a second. Now, some of you may be saying, okay, now I get really what I have to decide between, am I going to go supplement plus standalone drug plan or Advantage? For either one, I need to figure out what plan is right for me. How do I do that? How do I match myself with the right plan? Here's how. You have to identify and prioritize your healthcare needs and wants and match them with the plan. And I'm going to give you a few resources for information about Medicare plans. The first step is to define what are you looking for. And the first place to look is actually at your own healthcare usage in the last year or so. These are some of the questions you want to ask yourself. You want to inventory your past year and anything you know going forward, healthcare usage. What's going on? What kind of care are you going to need? Do you have a surgery coming up in the next year? So that's step one. This is all going to be in the handout you'll get tomorrow. Let me go back there. Once you do that, it's important to look at these are really your needs. It's based on your usage, but also note down, and I suggest you really write this down, It formalizes the process, and you have something to look back on. What are your preferences? Do you hate this pharmacy? Do you want to stick with your, knee surgeon, or have you had enough and you don't care exactly? You don't need him. You're willing to try someone else. These are some of the preference questions you want to ask yourself. Okay. When you have all that inventoried, your needs, your usage, your needs, your wants. By the way, that's a great practice to do once you've listed it out for yourself, to talk that through with a partner who will really ask you back, are you sure about this? Or you have 5 priorities, which we're going to talk about next. So what's most important? Of course, you have to think about what matters most. So that's going to be your lead in matching yourself with the right approach and plan. Once you're clear on what's most important to you in a supplement plus drug plan or an advantage plan, it's far easier to pick one. Most people just look out there. They look at the list of plans. Look in here first. Figure out what matters most. Talk it through with your spouse, with a friend, whoever it is. It helps. You see, with your priorities clear, you can search for the plan that fits best rather than shoehorning what you're looking for into some plan you happen to pick, the one your sister has, or the first ones you hear about. Or, as I often hear from clients, I want to go with a United Healthcare supplement because that's what my dad had and my mom had. That's what all of our parents had because that was really the first supplement out there. So there are better ways to figure out what approach and plan is right for you. So and here's a survey I did. I asked 200 folks. I got 35 responses back, but among that group, the greatest segment, actually 60%, responded that the ability to use the doctors that they want is the most important priority, to them. So you need to think about what's yours, what's your number one priority, and what are a couple of others as well. You see, the priorities are going to reveal the right approach. The priorities reveal the right approach. For your Part D drug plan, if you're going with a standalone or whether you're looking at that within an Advantage plan, you want to find selection's tough. There's a lot of options, whether you're looking at Advantage plans, this is just one element of looking there, or looking at a standalone drug plan that's going to be paired with a supplement. The secret is it's not about the premium. It's about the lowest total estimated cost for the year for the premium plus the copays for your medications. So for example, when I'm do an intake with a new client, I ask them to list for me every single medication, whether it's ongoing or as needed, dosage and frequency. And I plug that into my drug plan calculator, which you can do too at medicare.gov. And I figure out what's the least expensive plan for them from a reliable insurer. Of course, the reliable insurer is necessary. Finally, once you have your priorities defined, you can match them with the right approach and plan. The priorities, you see, reveal the approach. Here are a couple of scenarios. How do I get the fullest coverage when I live in 2 different states? It's common question I get from people, whether they're in one place often with the grandkids, or for the winters, they're down in Florida or some other sunny place. That would be a supplement. That would provide that, or some very flexible Advantage plans. You may say, my budget is super tight and I haven't had to go to the doctor for years. I'm not on any meds. Well, in that case, you might depending on your risk tolerance, want to go for an Advantage plan. These are just some possibilities. Always would want to discuss that with you. Here's one I get. My husband has MS or some other chronic illness. I know we have this one chance to get a supplement, and we need the most comprehensive and flexible insurance possible. So of course, they're absolutely right. It's a supplement. Here are a couple of resources that will help you find the plan that's right for you. Even if you don't have, if you want to get outside help in finding it, it's good to know what they look like. So Medicare.gov has a very good plan finder. You can just indicate what kind of plan you're looking for and key in your zip code, and you'll see what your options are. Your other option, or use the two together, is to work with a volunteer who focuses on this, and every state has a SHIP. It's called State Health Insurance Assistance Program. And these are volunteers who are very dedicated and provide, general information about the Medicare system. They cannot recommend individual plans. They just don't have that kind of high touch, nor are they licensed. Or you can use an independent Medicare broker. Make sure if you do that, you look at their Google reviews. You might want to ask for references, but you want to make sure they have some years in the field. They have represent multiple insurers, and just have an intro chat with them. You'll be able to get a sense whether ask about their process. You'll get a sense of whether they're right for you. Do not use just, there's some of these you shouldn't consider at all. And some of them, maybe they're a factor, just a very minor factor. Your doctor's office, they just know it from the billing point of view. For example, with supplements, all they do is send the bills to the government, and the government takes it from there. They don't know what company's best. Family member, friend, or neighbor, irrelevant to you. This is an absolutely individualized matching process. If you have a home or auto insurance broker, if the broker doesn't specialize in Medicare, or that's one of a couple of specialties, I don't recommend them. You want someone who's working with this stuff each and every day, hands-on. CPAs and financial advisors, they may know a lot. Some advisors actually are licensed. Again, for example, a lot of brokers support advisors, so advisors can do what they do best and focus on their core competencies, but they refer out for Medicare help. So let's review the problem. People lose access to the healthcare they need from the doctors they want, and overpay for medical care and medications by making the wrong Medicare decisions or not making any Medicare decisions at all. And you have your solution. Figure out when you have to enroll and what your timeline looks like. Get a sense of what decisions you must make, what choices you have for you, and that's going to be individualized as well. And then figure out what your priorities are. Whether you're planning to retire a year from now and that's when you're going to enroll in Medicare, or you're already enrolled and you're thinking about having someone audit your plan and seeing if it's still the best one, you need to do this self-check first. So prioritize your healthcare insurance wants and needs and preferences, and then match them either yourself or with the help of a volunteer or professional with the right plan. So I've downloaded a lot for you now, and it's a lot to absorb. It's going to be you can watch the video again to catch stuff. And now and of course, you'll have the worksheet to do your own homework on. I recommend you do that over the weekend, perhaps, while it's fresh in your mind. So I'm going to stop my share now and take questions.
Great. Thank you, Nancy. That was a lot of great information. So thank you very much. We have some really great questions, and so if we have some time, I do want to get your insights on them. First, when you're talking about enrollment um, and the comparable coverage for Medicare, does an employer's high deductible plan, which usually is kind of the HSA equivalent, right? Does that qualify as comparable coverage for deferred enrollment?
Yes, and it doesn't matter as long as you work for an employer with 20 plus employees, that your medical insurance should definitely count as equal to Medicare. If you have a question, you want to ask your HR department or the insurance representative whether that plan is creditable for Medicare coverage. But I've never heard of a case in which it's not. And a secret, Medicare doesn't really look into it.
Gotcha. Awesome. Um, Also, enrollment related. So you mentioned that you should enroll 3 months before your 65th birthday, but not when your spouse has health insurance coverage for both of you. Can you elaborate on that maybe a little bit?
Yeah, so whether you're covered by employer, a large, more than 20 employer provided assistance that's through your employer or your spouses or domestic partners, you're covered. You're covered and you do not have to enroll in Medicare A and B. If you aren't contributing to a health savings account, an HSA, then you, in most cases, would want to enroll in Part A. Be aware that, which is no premium, be aware that if you do contribute to an HSA and you enroll in Part A, then the two just don't mix. You're not going to be able, you're going to get taxed on those, any money is put in your HSA while you're enrolled in Part A.
Gotcha. Since Medicare Advantage is privatized, does Medicare contribute to Advantage? So in other words, are Advantage subscribers no longer benefiting from their years of contributing to FICA, Social Security, et cetera?
That is such a great question. Not only have you contributed through FICA taxes, et cetera, over the course of your career, whether you go supplement or Advantage, you must pay the Part B premium. That is consistent no matter what complementary plan approach you have. So not only have you paid those FICA taxes, but you also are paying that monthly Part B premium. What happens is that the reason that there are many zero premium Medicare Advantage plans, you don't pay now, you pay later, kind of the payphone model versus the unlimited mobile phone plan, which is a supplement. But the reason that some Advantage plans can do that is that the federal government, when you enroll in an Advantage plan, the federal government pays the insurer of your Advantage plan a per head fee. And they draw from that to provide you with care.
Great, thank you. Can you review the importance of the initial sign-up free look period where a plan will not do a comprehensive review of one's medical file?
Sure. I'm not going to use the term free look because that is just refers to a very specific thing, but let's just think of it as no underwriting or underwriting free. Underwriting is what we in the insurance field use to describe the review of health history in terms of health insurance. So you have one opportunity. So with the supplement, you have one opportunity to enroll in a supplement without underwriting, and that is to do so within 6 months of enrolling in original Medicare Part B. If you for some reason go past that, you didn't know, you thought your COBRA lasts for a year and you really didn't know about that deadline, you will go through a review of your health history. Now, and I do a lot of this kind of thing. You learn that every insurer has their own set of criteria, what they accept, what they won't. And as a matter of fact, those with supplements, people love them. And so they usually don't want to change them. But an important point to remember is after you've had it maybe 3 or 4 years, I always check in with my clients to see what they're paying, to see if they're overpaying, because with every insurance premium, the longer you hold one single policy, you begin to pay a greater and greater sort of a loyalty tax. So instead of getting a discount as a loyal customer, you're paying more because they think you're not going anywhere. So I try and move my folks when they're overpaying to the same coverage, the same supplement coverage from another insurer if they can pass underwriting. So underwriting is definitely a big part of this on the supplement side of things. There is no underwriting for Advantage plans, which you can change every year during the fall annual enrollment period to start January 1st of the following year.
Awesome. Thank you. You kind of covered this, I believe, but individual thought that Obamacare had gotten away from any pre-existing health issues for denying coverage. So why is that the case then if you wait to enroll in supplemental?
I mean, that is a good question. Supplemental insurance is not, it's pretty much independent of original Medicare. So it's always a surprise. So whereas the exchange, Obamacare, is a governmental system, supplement plans are not.
Makes sense. And that if you got time for maybe one or two.
I definitely do. Yeah, of course.
All right. This is a little more specific to drugs. So do you know any PDPs that cover the majority cost of tier 4 drugs?
Yeah, so what this person is talking about is that every health insurance plan, including the plan you have now, categorizes medications in terms of tiers. And as the tier number increases, so does the cost from the pharma to the insurer and from the insurer via the pharmacy on to you. And tier 4 drugs are the most expensive drugs before you get to tier 5, which are called specialty drugs. Frequently, every plan, first of all, categorizes drugs in their own way. And so what is a tier 4 in one, as defined by one plan, might be a tier 3 in another plan and a tier 5 in another. And there are and really it depends on the combination of drugs. You can't isolate any one drug. So usually the individual pays a lot for tier 4 drugs. What's great though is that due to Biden's Inflation Reduction Act, there is a first-time cap for individuals on Medicare for what they pay out of pocket for medication copays. And that is $3,300 this year. And I know that sounds like a lot, but there was never any cap, before. So it's a huge win for Medicare beneficiaries. Awesome. Keep in mind also for very expensive drugs, sometimes, and this can be for drugs at, lower tiers like albuterol, which can be very expensive on a plan. If something pops up on a plan I'm researching as very expensive, I frequently look at some of the discount sources for drugs like GoodRx, Cost Plus Drugs, which is from Mark Cuban. And sometimes it will advise people, if you want to take this extra trouble, you're going to save money by getting this outside of insurance via one of these plans. Keep in mind, if you take that path, that drug doesn't count towards your drug plan deductible because you're not purchasing it within your drug plan.
Great. I think this is probably the last question. So if an individual over 65 is a part of a large employer, there's a lot of people that still switch jobs past 65. And so if there's either a gap in employment or things like that, or even maybe someone who didn't sign up in time is afraid of the penalty or anything, could they go then get a job at a large employer for a period of time? Like, how does that actually work for someone after 65 with any particular gaps of employment relating to the initial sign up period?
Okay, so if you have a gap of employment, then people do this in two ways. If you sort of have another job in the horizon, you can just COBRA it for a couple of months. Don't tell them you heard it here. But if you don't know, I suggest you enroll in Medicare. You can't disenroll if you are able to get another position. Another question I get, sometimes people wonder, let's say they have a high deductible plan. They wonder, how does that stack up, both in terms of the cost and the coverage versus original Medicare and a supplement, which work together, or an Advantage plan. And I do assessments like that. Typically, since employers typically contribute to the premium of employer-provided insurance, for most people, that's the way to continue going, as long as you have that.
Great. And I think this is probably the last one. So some people throughout the course of their life have decided, for whatever reason, based on their situations, to opt out of Social Security. How does that potentially affect their Medicare, if it does at all?
Yeah, that's a great question. It is very confusing because you do enroll in Medicare through Social Security, and it's only once you're enrolled that your Medicare itself is managed by CMS, the Federal Medicare Agency, and you set up your account online at medicare.gov. It has nothing to do with whether you take your Social Security or not. And if you enroll past 65, they will ask you, do you want to, or even before, because you can take it as early as 62, do you want to take on the online form, do you want to take your Social Security benefits or not? So if you don't want to, you want to wait till 70, whenever you want, whatever you've discussed with your financial advisor, then you say no. I really, never heard of someone confusing that. It's one of the things that's very clear on the enrollment form.
Great. Well, I think that's all of our questions. Nancy, I want to thank you for your time, and thank you for sharing a lot of information with us today. For everyone that attended, we appreciate all of your time as well. As she mentioned, we're going to send out a follow-up email probably tomorrow morning sometime with the information she described. It'll also have her contact information if you're looking to potentially reach out to her directly for your own specific situation, along with a replay of this webinar as well, so you can watch it again and digest it even more, because it is a lot of info. So Nancy, thank you very much. At this time, we're going to wrap up, and thank you all for attending.
Right.
Take care.